Today, I'm Eric Turcotte, and I'm a registered physiotherapist in Ontario, Canada. Today we're going to discuss shoulder pain, more specific to kayak anglers, right? So I got my props here. So this is a shoulder. It's a right shoulder. So if you look at it, you have the arm itself. It's like a ball and a socket type of joint. You got your clavicle on the back, you got the shoulder blade called scapula, and the scapula also help raising the arm like this. So if you have weakness in the scapular muscle, the arm is going to be taking all the load. We're not going to discuss much of scapula, it's going to come in the other video. Today we're going to focus on the shoulder joint. So it's a ball and socket type of joint, so the ball and the socket, which provide a lot of mobility but at the expense of stability. So the stability of the joint is provided by muscle and ligaments. Most specifically the rotator cuff complex, known as the rotator cuff, which is 4 different muscles in the anterior aspect of the shoulder and the posterior aspect of the shoulder. Most of those rotator cuff muscles are not much bigger than your thumb. So they're prone to injury, and most of the injury occur at the tendon, which is the attachment of the muscle to the joint itself. So as attached to the joint, it gets thinner and thinner, and repetitive use of this muscle will create tendonitis. So tendonitis is basically inflammation, overuse of the tendon of the muscle itself. So the tendon and the muscle is the same thing, it's just the attachment itself to the joint, right? So the most frequent part of the shoulder that it's affected is the anterior aspect of the shoulder, and that's because with time we have the tendency to sit with our shoulder rounded like this, right? It creates a lot of anterior instability of the shoulder joint, and it creates pain over time. The other injury is shoulder impingement syndrome. So again, the anterior, most of the time, it's the anterior aspect of the shoulder joint. The muscle, the ligaments, or the tendon itself gets squished between the space to the shoulder joint to any bony prominence of the shoulder joint. So impinge, so squish, impinge. It creates impingement, which will create pain in the shoulder. So most people report pain in the anterior aspect of the shoulder, in the deltoid area. Not so frequently, but sometimes you will have some tingling down your fingers, depending whether or not you got nerves that are also impinged in the structure, right? So this happens at end range, any movement at end range, which involve paddling in your kayak, right? So as you can see, when you paddle, not the best technique here, I don't have a paddle. As you paddle, you're putting end range, a lot of stress on the shoulder. We have the tendency to bend forward, and then you're coming back against resistance in the water. So that's one way you can injure your shoulder, creating tendonitis or shoulder impingement on the water. The other way is casting, repetitive casting. Again, it's a quick motion at end range, bending forward. We have our head forward, our scapula, shoulder blade rounded like this, right? And we do 1,000 casts a day. I don't know how many casts, I'm just saying a number like this, repetitively, right? And then set the hook against resistance, create a lot of stress on the shoulder. So again, a lot of mobility in the shoulder, but not much stability. Stability is provided by strength. So you will need to eventually strengthen the shoulder complex, also the scapular muscle that helps bring the arm up. But we'll see that in the off season. At this stage, it's not time. You won't have time to strengthen the muscle. It takes 4 to 6 weeks to any strengthening program. What we're going to view today is simple exercise that you can help you self-manage your shoulder pain, right? So it's going to mobilize the joint itself, and it's going to stretch the anterior capsule and the posterior capsule of the shoulder. You'll see in the other video the exercise I'm going to show today on dry land. They're also applicable on the water. So I make a short video on my kayak showing you that you can do this on the water as well, right? But today we're going to see them on dry land. So the first exercise to do is pendulum. I'm going to stand up a minute. So you just bring your arm, let your arm loose like this, and just do circle like this. So it's called shoulder pendulum. You can add weight, a bottle of water, a 5-pound bass, or just simply a 1 to 2 pound dumbbell. So you just rotate like this, one side, other side, no specific time, couple of minutes, or until the pain is relieved. So it's called shoulder pendulum, right? So the next one, when you're sitting in your kayak, I mentioned scapular muscle, right? So as you have your shoulder rounded like this, it stretches the muscle around the scapula, make them weak, and also creates some tension in the muscular complex of the scapular muscle. We often call that trigger points. We'll discuss trigger points in another video. You'll have pain in specific area in your shoulder blade. So what you do is sit up straight, bring your head backwards rather than forward at posture, and you bring both scapula, shoulder blade together, and you hold that position 2 to 5 seconds, 10 repetitions. So as you notice, I'm not rounding my shoulder, I'm just bringing both shoulder blade together. If you want even more stretch, you can rotate both arms like this. You're going to feel that right in the middle of your thoracic spine. Good. You hold 2 to 5 seconds and relax. This is also good to release some of those trigger points. So again, rotate your arm out, 2 to 5 seconds, 10 repetition. I like things simple. You're going to notice 2 to 5 seconds, 10 repetition is something I use a whole lot because it's easy to remember, right? So that's the scapular muscle. The next one is shoulder extension. So you bring this here, and you're going to do it in sitting. Keep your elbow and everything straight. Make sure you're not moving forward like this. Your head is mostly posterior rather than forward. You bring your arm on your own as far out as possible, and then you apply a tiny bit of pressure by pushing on the broomstick. Guess what? Hold 2 to 5 seconds, 10 repetition. On the water, you can use your fishing net, your fishing pole, or anything that you have available, your stick, right? Your wind stick, wind anchor, whatever you call it. Good. And 10 repetition. So this will stretch the anterior capsule of the shoulder. It's very good if you have a shoulder impingement, right? It's going to help releasing that tension on that soft tissue, the muscle that's affected. So 10 repetition. So to stretch the posterior aspect of your shoulder, posterior capsule, you just bring your arm horizontally like this, apply a little bit of pressure. I'm going to let you guess, 2 to 5 seconds, 10 repetition. Two to 5 seconds, 10 repetition. And that's it. Those simple exercises will help you self-manage your pain. It won't resolve the issue, but it will help you self-managing the pain. You can do that a couple times a day regularly when you're in the water, because you're going to do a lot of paddling and casting, repetitive motion at end range. You want to do this every hour or so, definitely before and after kayaking. So next video I'll discuss scapular pain, so stay tuned, look for my blog on Facebook and YouTube, and we'll talk to you again. Stay safe and always wear your life jacket. Have a good day.